And we're joined this morning by the York County Coroner. She is Pam Gay. And if you read the York Daily Record today, she came out with a report about the 2020 report on deaths in the pandemic, which was kind of interesting. And I wanted to get her comments on it this morning. She joins us here on WSBA. Good morning, Pam. Great to have you aboard.
Good morning, Gary. It's good to be here.
Well, thank you on such short notice, too, because I just called Pam this morning. She was all ready to go and really appreciated that. And, I wanted to, just wanted to find out a little bit about this, because one of the things I thought was interesting in your 2020 annual report that you give out is that you can get a little frustrated now and then, right? And frustrated when people talk about COVID-19 deaths being manipulated and things like that. But wanted to get kind of the essence of your report this morning, if you could share it with people.
Yeah, I think one of the things that people find surprising is that the coroner has investigated 19 COVID deaths, but that doesn't mean that that's the only COVID deaths that occurred in the county. What happens is most COVID deaths are considered natural. They're certified by physicians in hospitals, and so they're reported to us pretty much every time one occurs, but we only investigate them if they're a coroner case for some reason. If there's, for instance, a COVID death in the community, or we have had some COVID deaths where it's complicated by maybe a hip fracture or a brain bleed, that kind of thing. But most of them are certified by the physician. So by the end of 2020, we did have 419 reported to us. That includes the 19 that we investigated. And we're already at 643 since the time of the pandemic. We have access to those. We have access to that information, and we can verify it through the state. So. Now,
your frustration, as we saw in 2020, and I guess in your business, you're dealing in facts. You're dealing in, okay, here's, as much as we humanly can do it, here's what happened, here's how someone passed away, whatever it might be. Right. We watch politics get intertwined an awful lot with some of this information in 2020, and I guess that kind of complicates everything a little bit, doesn't it?
It does, and one of the things that was concerning at the beginning was there was a lot of discrepancies, and we wanted access to those Department of Health records so that we could verify that those numbers were indeed pretty accurate. I will say that sometimes the numbers are off a little, but that has to do with epidemiology and the way the death certificate is figured out.
Sure.
But generally, our numbers are pretty much in alignment as far as what's reported to us for death matches what the state, pretty closely. It matches what the state hands out or shows us on their data. The difference being we're a little bit ahead because we're getting real-time reports, and the state is sometimes playing the paper trail because some of the doctors in nursing homes in particular are still using paper.
From your look at it, and from looking around the country and even here in Pennsylvania, there were a lot of accusations about people fixing the numbers and so forth. Did you see any of that at all? Did you see anybody trying to play with the numbers at all on the state level or any other level for that matter?
Not for the deaths. I will tell you that's what I'm responsible for verifying and checking, and I haven't noticed that with the deaths. They appear valid to me, and I actually must. Some of us, this isn't popular, but some of us believe that there's an undercount because when COVID first began, we weren't able to test everybody. And there's classic symptoms that we sometimes see, but we can't, call it COVID because, we haven't really tested them or weren't able to test them. So we believe that there was an undercount, especially at the beginning.
I was reading in the article about your report, and they were talking about this number, the numbers of deaths in York County in 2020 was almost like a perfect storm when you looked at the COVID-19 combined with the already existing opioid epidemic. What were your thoughts about that? We had unemployment, isolation, lack of personal contact. Does that all come together? And if so, kind of talk to us about that a little bit.
Yeah, that's what our executive director of the Opioid Collaborative, Brittany, she calls it the perfect storm, and it really was because unfortunately we had an increase in our overdose deaths drastically, and that's actually what kept the coroner the busiest. While the COVID deaths were keeping our first responders and the hospitals really busy, it certainly kept us busy a little bit too because we had to prepare for everything potentially being a COVID death. We were most busy because of the increase in overdose deaths by about 65 till it's all said and done. We have about 10, 11 pending yet.
Wow. One of the things that I saw in your report also, Pam, again, we're talking with Pam Gay, the coroner for York County, was you said it could have been worse. We could be in a far scarier place, I think was the exact quote, when you look at the past years and the county's overall population growth. Talk a little bit about that comment. I'm interested in that.
Well, thankfully, our homicides did not increase. They actually decreased. There were 19 this year, 22 last year. Our suicides actually decreased for the second year in a row. They were 60. Still tragic. Obviously, it's a totally preventable death. But definitely, with these deaths of despair that occur as a result of, the pandemic, we were concerned that those suicides would increase because some counties did see that. And our traffic crash deaths stayed about the same. Our home and play deaths went up a little bit, but that's mostly because we have so many fall deaths.
Yeah. What should people take away from your report, Pam?
That we have a growing, aging community. So for some of those deaths, it's going to be natural for them to increase, obviously. Somewhat natural. But we take from it every year what we can do to try and educate the public and try and prevent those deaths from occurring. Coroners' deaths generally are pretty preventable. And so we want to make sure that we take that information and get that education to the community so that they can hopefully at least take it and possibly, change the course of their, patterns of behavior or how they take care of themselves or don't take care of themselves. And also that there's help out there for the individuals
Right.
who are struggling.
A little bit of preventative and proactive kind of stuff. Hey, Pam, thanks so much for taking the time to be with us this morning. Really appreciate it.
Thank you, Gary. Take care.
And take care now. Pam Gay, the coroner of York County, with us here on WSBA.